OptiMap, ultra-wide-field retinal imaging. We all want to protect our gift of sight, which is why regular eye exams are so important. Regular eye exams not only allow your vision to be checked to determine if you need glasses or contact lenses, but also to assess your overall eye health. Even if your sight is fine today, it may still change over time. Early signs of many eye and systemic diseases may appear on your retina long before you notice any symptoms. The earlier these signs are detected, the greater the chance that the treatment will be successful. To help preserve the health of your eyes today and in the future, this practice offers OptiMap ultra-wide-field retinal imaging, which is suitable for every patient, including children, at every eye exam. Let's take a closer look at OptiMap and the eye itself. What is the retina? The retina is a thin layer of cells lining the back of the eye and covers 65% of the inner surface. The retina works by converting light into impulses and then sends them to the optic nerve, which in turn carries them to the brain. If damage occurs to your retina, your vision is at risk of deterioration. Traditional methods of examining the eye allow only a narrow field of view of your retina, similar to shining a flashlight into a dark room. A fundus camera photo may be taken so that a view of the central retina is captured. However, the fundus camera shows only approximately 15% of the retina at one time. Because this practice offers OptiMap retinal imaging, we are able to capture up to 82% of the retina in a single image capture. This means that early signs of retinal disease can be detected more efficiently and effectively than with traditional, smaller field imaging methods. Sometimes, symptoms can go unnoticed in the early stages of any disease or ocular condition, and you only realize there is a problem when you experience changes to your vision. In addition to eye conditions, signs of other systemic diseases can also be seen in the retina. Early detection is vital and means successful treatments can be administered to reduce the risk to your sight and health. Having an OptiMap is quick and takes less than a second. Images can be taken through small pupils and most cataracts. At the discretion of your eye doctor, dilation drops may not be necessary. This means that you are able to drive home and carry on with your day. Your doctor may show you your retinal image in a unique 3D wrap sequence. OptiMap images are digital and stored for comparison of previous and current images. Viewing your OptiMaps over time allows your eye care professional to detect and monitor any subtle or significant changes. Autofluorescence imaging shows how the retina is functioning. This means that any signs of retinal stress can often be seen before any structural damage takes place. It's important for children to have a regular eye exam, as many vision problems can begin at an early age. Good vision is essential for their physical and educational development. OptiMap was invented by Douglas Anderson when his son Leif went blind in his left eye at age 5. Unfortunately, a retinal detachment was detected too late for treatment. In an effort to improve the standard of care available during an eye examination, Douglas, an engineer, worked for 10 years to commercialize the OptiMap. More than 400 completed and ongoing clinical studies support OptiMap ultra-wide-field retinal imaging, which is becoming a recognized standard of care in many practices. OptiMap ultra-wide-field retinal imaging helps you and your family maintain healthy eyes. This practice recommends that every patient has an OptiMap retinal image. Ask for an OptiMap today.
Glaucoma patients face a gap in their care between non-compliance with drugs and an invasive surgery. Iridex bridges this gap with the MicroPulse P3 device, an innovation in transclerocyclophotocoagulation powered by the Cyclo G6 glaucoma laser system. What sets MicroPulse technology apart as a solution for glaucoma patients? With standard laser technology, a continuous beam is delivered to the tissue, leading to heat buildup that may cause tissue damage. MicroPulse technology chops that laser beam into trains of repetitive on and off pulses, giving the tissue time to cool between pulses to prevent damage. A controlled prospective study performed at the National University Hospital Singapore resulted in a 33% reduction in IOP at 18 months, and medications were reduced from a mean of 2.1 to 1.3. The laser console is efficient and straightforward for the physician and the patient. MicroPulse P3 can be performed in the office or in the OR and is highly efficient. Setup is easy.
Do you really know what biomechanics is and what it has to do with the cornea? It's actually very simple. Biomechanics describes how biological bodies react to outside forces, for example, pressure. A distinction is made between elastic and viscous properties. Elasticity is the ability of a body to return to its original size and shape after using force, like a spring. The more elastic a body, the better it is at doing this. Stiffness describes how much force is needed to elastically deform a body. This depends on both its composition as well as the amount of material. Viscosity is the resistance against permanent deformation. Viscous bodies can no longer return to their original state or only do so slowly. The cornea is both viscous and elastic, which means that it retains its form after being exposed to outside forces and only later returns to its original size and shape. A healthy cornea can do this relatively quickly. It's elastic and stiff. In the case of an ectatic cornea, the biomechanical properties are changed. This leads to increased thinning and bulging of the cornea. For example, laser surgery could cause ectasia. The elasticity and stiffness of the cornea therefore have a lot of importance in ophthalmology. For example, in corneal cross-linking, intraocular pressure measurement, or corneal incisions. However, the stiffness of the cornea could never be measured individually until now. Corvus ST from Oculus makes this possible for the first time ever. Pressure is applied to the cornea via an air puff, and a high-speed camera records the change. The Corvus software uses this to calculate a stiffness parameter of the cornea. These data are of particular relevance for screening before refractive laser surgery. In combination with the Pentacam, Corvus ST provides dual safeguarding. Patients at risk with a predisposition for ectasia that can't be detected by corneal geometry measurement alone can be detected by means of corneal stiffness measurement. At the same time, the joint analysis helps in determining if any patient can be operated on safely. On the basis of tomography, some of them would have to be refused surgery due to reasons of safety. Corvus ST therefore helps you to operate on more patients safely and also reduce the risk of an incorrect decision. Oculus.